Hello students, in this video we'll talk about the body fluid volume osmolarity changes in different situations where you have the fluid loss. So coming to the distribution of water in the body fluid compartments, we all know the body fluid compartments are divided into two compartments or two major compartments, that is the extracellular fluid or ECF and the intracellular fluid or ICF. Now, the ICF is approximately two-thirds of the total body water, and ECF is approximately one-third of the total body water. So, if you want to see the ECF volume in terms of the body weight, it is 20% of the body weight, and ICF volume is the 40% of the body weight. And if you look at the osmolarity of the ECF and the ICF, it is similar, and the normal plasma osmolarity ranges from approximately 280 to 295 milliosmoles per liter. Now, if you look at the graph or the graphical representation of volume and solute concentration in ECF and ICF, the x-axis is the volume and the y-axis is osmolarity. And the osmolarity of both the compartments is approximately 300 milliosmoles per liter, and the volume of ICF is more than that of the ECF. Now, if we draw the diagram, that is the volume osmolarity diagram, this is also called as the Darrow-Yannet diagram. It is a graphical representation of the volume and the solute concentration in the extracellular fluid and the intracellular fluid. The solute concentration is expressed as osmolarity, and the unit is milliosmoles per liter. So to understand how the body osmolarity and volume in the ECF and the ICF changes in clinically relevant situations, we draw the diagram. The x-axis denotes the volume of the ICF and the ECF, and we know ICF is two-thirds of the total body water and ECF is one-third of the total body water. And the y-axis is denoting the solute concentration or the osmolarity of the solution. And if you look at the solid line, which is seen here, it represents the control state, and the dashed line, if you see, these are the dashed lines which show a change in volume and osmolarity. So if a dashed line cuts the x-axis, and if it cuts the x-axis, it denotes the changes in the volume. And if the dashed line cuts the y-axis, it denotes the changes in the osmolarity. Now, if the dashed line cuts the x-axis and is inside the solid line, then it denotes the volume is decreased. And if the dashed line is cutting the x-axis and it is outside the solid line, then it denotes the volume is increased. The same is with the osmolarity dashed line. You have a dashed line. If it cuts the y-axis and if it is inside the solid line, then it denotes a decrease in the osmolarity. So if you look at this diagram, it shows that the ECF volume is decreased, the ECF osmolarity is decreased, or osmolarity of both the compartments are decreased, whereas the ICF volume is increased. So this is just giving you an idea about how to interpret the volume osmolarity diagram or the Darrow-Yannet diagram. Now, coming to the situations where you can see a change in the volume and osmolarity, the first situation is the loss of isotonic fluid. Now, when you lose the isotonic fluid or lose a fluid from our body, the change is observed first in the ECF volume. ECF volume is reduced because fluid is lost from the ECF compartment. So you can see here the dashed line is inside the solid line for the ECF volume. So ECF volume is reduced. Now, because there is loss of isotonic fluid, there is no change in the ECF osmolarity, because when you lose isotonic fluid, you lose equal proportion of water and solutes. So the osmolarity of the ECF does not change. Now, if the ECF osmolarity does not change, then the ICF volume is not going to change. So it also remains unchanged, as ECF osmolarity will be same as that of the ICF osmolarity. So there is no net movement of water from one compartment to another compartment. So if you see in the diagram, the ECF volume is decreased, but ECF osmolarity or the ICF osmolarity and ICF volume are unchanged. They remain the same. Now, if you lose hypotonic fluid, the ECF volume is going to be reduced because the fluid is lost from the ECF compartment, which can be seen in this volume osmolarity diagram. You can see the dashed line is cutting the x-axis and is inside the solid line, and that shows that ECF volume is decreased. Now, if you lose hypotonic fluid, what happens to the ECF osmolarity is it is going to be increased. When you lose hypotonic fluid, you lose more water than the solutes. So more solutes remain in the ECF compartment, which will increase the ECF osmolarity. Now, this increase in the ECF osmolarity will cause the movement of water from the ICF to the ECF. So, the ICF volume will be decreased because there is movement of water from ICF to ECF. That is because of increase in the ECF osmolarity. Water moves from ICF to ECF due to osmosis. And how long will the water move is it will move until the osmolarity in both the compartments become equal. So that until then the water moves from ICF to ECF. Now, the last situation where you can have a change in the ECF osmolarity, volume and the ICF volume is the loss of hypertonic fluid. So whenever you lose the fluid, the ECF volume is going to be reduced because fluid is lost from the ECF compartment. So you can see here the dashed line which cuts the x-axis is inside the solid line. That means the ECF volume is decreased. Now, what happens to the ECF osmolarity when you lose hypertonic fluid is it will be decreased, because when you lose hypertonic fluid, you lose more solutes than water. So more solutes are lost. So you have less solutes in the ECF compartment, and this will decrease the ECF osmolarity. So if you see the dashed line is below the solid line and cuts the y-axis, that denotes ECF osmolarity is decreased. Now, because ECF osmolarity is decreased, it is less than the ICF osmolarity. So increased ICF volume will be increased because water will move from ECF to ICF, because ECF osmolarity is lesser than the ICF osmolarity. So water moves from ECF to ICF due to osmosis, and this will increase the ICF volume. And how long the water moves is until the ECF osmolarity and the ICF osmolarity becomes equal. So that is about the loss of isotonic fluid, hypotonic fluid and hypertonic fluid on, and its effect on the ECF volume, ECF osmolarity and ICF volume. Thank you for watching.